Mrs. White?
Yes.
Hi, my name is Alice. I'm going to be your nurse this evening.
Okay.
How are you?
Good.
Good. I just wanted to go over some exercises and precautions with you dealing with your new hip.
Okay.
Has physical therapy been with you today?
No, they have not been up yet.
Okay, so this is going to be the first time reinforcing the new information. I know you've got some from the joint class, but after having the surgery, we just want to go over with it with you, okay?
Okay.
Is it okay if I turn off your TV?
Yes.
Okay. And can you tell me your name and your birthday?
Yes, my name is Betty White, and 3/28/1950.
All right. Do you wear glasses, any hearing aids?
I have hearing aids, and they're in.
Okay. And how's your pain right now? We use a number scale here. 0, no pain, to 10 with your worst pain. What would you rate it?
A 2.
Awesome. So you're able to do the exercises?
Yes.
Good. Okay, Mrs. White, I created a little handout for you. Okay. It's an outline of all the exercises and precautions that we're going to go over today. Okay. I'm going to hand this to you. You can keep this as a reference guide on your bedside. You can use that when you do the exercises on your own. Okay. So I want to tell you why we're doing these. Pretty much we're maintaining circulation in your legs. For your type of surgery, you're at high risk for blood clots, so you want to create that circulation, and there's some exercises I'm going to show you to help maintain that. They also cut away tissue and muscle, so we're trying to regain that muscle strength as well as develop movement again in the operative hip. Okay. And the third thing, we definitely don't want to pop that new hip out. You're at high risk right now for dislocating that hip, so we want the precautions is to help prevent that. Okay. Okay. So the 4 important precautions, the do nots. Okay. Okay. The first one, do not bend past 90 degrees. That means no squatting, no bending. Okay. Okay. Make sure your knees is lower than your hips. Okay. The second one, do not cross. Sometimes when you're laying in your bed, you don't think about it. Sometimes your ankle crosses the other ankle. No. Okay. Do not cross. The third one, do not put your knees together. Okay. Because the more your knees come together, eventually you are going to cross those legs. Okay. And the third one, don't rotate your foot in or out. And what I mean by this, so I'm going to use your non-operative leg, is bringing your foot in and bringing your foot out. Try to keep your toes straight up to the air, okay, as much as you can. And you can prop your leg up on pillows to help prevent that. Okay. All right. So, some exercises I'm going to show you in the bed. Very easy. The first one's ankle pumps. Okay. You bring your toes inward and bring your toes outward. Okay. Okay. So on your non-operative leg, I want you to bring your toes in and bring your toes out. Bring your toes in and bring your toes out. Now we're going to try on the non-operative leg. Bring your toes in, bring your toes out. Do it again for me. Bring them out. Very good. Another exercise we're going to do is abduction exercises. And what is that is you take your leg and you bring it outward to the side and bring it back in where you had it. Okay? So on your non-operative leg, I want you to bring it out and bring it in. Bring it out again and bring it in. Very good. Now we're going to try with this leg. I know you can't do it on the first day, of course, but just try a little bit, okay? So I want you to bring it out and bring it in. Bring it out. Bring it in. And then the third one is leg raises. Okay. You just bring your leg up as much as you can to your point of resistance and bring it back down. So let's try with this non-operative leg. Bring it up. Bring it down. Bring it up. Bring it down. With this one, I know you can, of course, do it, but just try a little bit if you can. Bring it up. Bring it down. Very good. Try it one more time. Very good. Now, of course, since you can't raise that leg completely when you're getting out of bed, you can use this prop. It's a bed leg lifter. Pretty much you just loop it around your foot, grab hold of the same hand, and just bring it up. And that's to help it lift it, okay? Alright. So just making sure you understand the precautions. Can you identify the 4 precautions back to me?
Okay, so never have your feet bending in. Don't let your legs cross. And don't let your knees touch.
Okay. And what's the 4th one? We don't want to bend past that 90-degree angle.
Yes.
So no bending and no squatting.
Okay.
Alright. Now I'm going to ask you to do the exercises that I just taught you.
Okay.
And you just try to demonstrate it back to me. So if I want you to do a leg raise, and you can do it with the non-operative, of course, what would you do? Very good. What if I told you to do an ankle pump? And then an abduction exercise. Very good. Now we can move on to the standing exercises, okay? Okay, Mrs. White. So now the next 3 exercises that we're doing standing up.
Okay.
And I'm just going to go ahead and list what these exercises are. First, we're going to learn how to stand up. Then we're going to learn how to use the walker. Have you ever used the walker before?
No.
Okay, so it's the first time using that. And as well, we're going to do abduction exercises standing up. And why I'm using that one, because it's using that hip, using that joint. Okay?
Okay.
So the first one, we're going to learn how to stand up.
Okay.
So you want to make sure your feet is firmly planted on the ground.
Okay.
And make sure your knees are apart.
Okay.
Is that one of the do nots that we
Yes.
do not try to keep your feet or keep your knees together? You want to keep them apart. When you stand up, I want you to push up from the bed.
Okay.
Okay. Very good. Go ahead and grab hold of that walker.
Okay.
Very good. How do you feel standing up?
Good.
No dizziness, no lightheadedness?
No.
Alright. I just have this gate belt around you to just help me have a better hold on you, okay?
Okay.
So now we're using the walker. It's a little bit trickier than standing up, of course. But this is just to relieve pressure on that hip.
Okay.
Sooner or later, you're going to learn how to bear full weight on that hip without using a walker. Right now, we're going to use this. So what I want you to do is bring the walker out some.
Okay.
And I want you to bring your bad leg, your operative leg up.
Okay.
Bring it all the way up for me, as much as you can. Make sure that the heel is the first thing that touches the floor.
Okay.
Firmly plant your foot. Very good. And then I want you to bring your good leg up and bear all your weight on that walker as you bring that good leg up.
Okay.
Very good. I want you to bring the walker out some more.
Okay.
As you lift up your leg, I want that toe to be the last thing that come off the floor.
Okay.
There you go. Heel first, flat. Bring the good leg up. Bear weight. Very good. Now we're going to learn how to back up to the bed.
Okay.
Okay. What we're going to do is we're going to take that bad leg back again.
Okay.
But the first thing that's going to touch the floor is your toe this time. Bring the good leg back. Very good. Bring the walker back. Very good. As you back up, before you sit down, you want to make sure that bed or the chair is touching the back of your knees.
Okay.
Okay, is it touching the back of your knees?
Yes.
Alright, then we'll go ahead and sit down. Alright. So now that we've done the exercise, I want you to stand up for me without me instructing you. Very good. Grab a hold of that walker.
Okay.
Good. Now we're going to do the abduction exercises, okay? So just bring your walker up just a little bit, but I still want you to have a hold of it just in case you start feeling off balance. And with that post-operative hip, I want you to bring it out. And of course you can bear weight on that walker if you can't lift that leg up on that bad leg. And bring it in. Very good. Bring the bad leg out as much as you can. And bring it in. Very good. Now we can sit back down. Mrs. White, before I leave you, I just want you to identify back to me why we're doing these precautions and why we're doing these exercises.
Okay. So to prevent blood clots, so we want to make sure the circulation's good. We want to develop muscle strength, and then we want to prevent the dislocation of my hip.
Very good. All right. Well, our teaching plan is over. I'm going to give you this evaluation sheet. This is just evaluating what I've taught you, how well I've done. If there's needs for improvement, don't hold back. I definitely want to hear your feedback, okay?
Okay.
All right. Well, it was nice meeting you, Miss White.
Thank you.
If you need anything, you just let me know. Are you having any pain right now?
No, I'm not.
All right. Well, if you need anything, you let me know, okay?
Okay, thank you.
You're welcome.